They tell me, how many days maximum do you need me when I'm going to do my All-on-4? Well, to all my patients that they ask, I want to answer that at least if you come a week, that will be good. And you say, yeah, but why if the surgery takes you at least 2 hours? What are you going to do in those days? Well, first of all, we're going to do on the first day that diagnose. We're going to take those CT scans, we're going to take those x-rays, and no matter where you do it in the world, doctors now they need to see you clinically, because if you're pretending to travel, now you need to see the patient clinically, and that's where you do your final measurements about how you're going to place that All-on-4. So if once you have that patient there, you perform the surgery, you're going to be waking up with the implants, uppers and lowers, all the extractions, the bone leveling, and the implants placed. And what's going to happen on your second day, now that you already have those implants, that you already have those sutures, that will depend a lot if the doctor wants to do the immediate load or delay load. On my personal point of view, I really recommend more to do the delay load. Why is this? Because you don't want no pressure. Don't mess with those implants. Let those implants stay there. You don't need to move them. Once you leave those implants there, that's going to be way much better. Then you're going to do the waxing, the tryout of the wax. Remember that probably you lost that vertical dimension, or you have an overjet or an underbite. You're going to correct that. You're going to have those waxing, and then teeth over wax, those teeth that you always wanted, you're going to have them on temporaries, and then the finals. But meanwhile, and the most important thing is this. Remember that you're going to have a surgery. You're going to have a full flap surgery, uppers, full flap surgery on lowers, and you will need to wait. Those days are going to be very important because you're going to be having that healing process working in, and you'll be having that timing that is going to be normal for your body to recover. So once you have finals, doesn't matter if they are going to be screw retained or not. My recommendation is that they are not. You're going to have those temporaries like dentures, something like that. Yes, but thank God you have them. So you'll kind of have them for at least 3 months. Below the gums, those implants are going to be healing, doing the osseointegration, and then afterwards, you're going to come back. So at least my personal point of view, and also because you had that stress like, oh my God, should I do it or not? Well, you need to have the surgical procedure done and then the recovery time. So give those days to you. You deserve it. Those days are going to be the most important days in your life because you're going to be on a path to a life-changing story. So if you're pretending to do an All-on-4 with me or anywhere in the world, do your homework. Search for a doctor that places implants and restores implants. Do your homework. Dr. A, bye.